Hi friends, hope doing well. I'm Dr. Milind. So recently NEETPG 2024 concluded and students had mixed reaction after the exam. So I had conducted one small poll and I wanted to discuss with you the post-exam analysis and also what are the learning points that we get from this year's NEETPG as we'll be facing next session at city. So when I had conducted the poll, we know that there were two sessions of NEETPG. So session one, most of the students they voted as moderate to difficulty level of difficulty for this exam, but a lot of students failed. That session 2 was on more on the difficult side as compared to session 1. Also, when we talk about the subject percentage, we always know, like we have also discussed in the past on our channel as well, that usually NICT is more about the basic sciences, and in NEET PG you get a higher weightage for your big four subject like medicine, surgery, obstetrics, and EPSM. And definitely this subject had quite a higher weightage in both the sessions. Now, when I talk to multiple students and what we have also seen in different posts on social media, so if I look at the students' perspective, so what I have seen is students said that there were a lot of image-based questions like in all the sets. Also, especially in the session two, they had a long summary questions, and it took a lot of time for these questions to understand. Also, there were a lot of language issues. The arrangement of the questions, the arrangement of the options was also something that student found quite troublesome. Also, a lot of students failed that topics from the previous exam or the you know they do like they were repeats, but they were the topics. But the questions asked from those topics were quite tricky, and there was difficulty solving those MCQs. A lot of students also felt that this exam was more of a NICT or USMLE kind of exam. This pattern was followed. We had a lot of clinical scenarios, clinical based questions, and unanimously everybody felt, all the students that came out, that this exam was one of the toughest. And if you compare to multiple sessions like previous multiple NEET exams, so a lot of students felt that this was a really tough exam. Now I want to say that definitely this exam was tough, but remember, it's for everyone. Whatever classes you have done, whatever study material you have used, everybody has read the same. So famously, one of the teacher during my preparation time, one very famous teacher from one, I don't know, want to name him, but he used to say, ki, if it's not in our notes, probably nobody knows it. So same thing. If you know, if you don't know it, most of the people, more than 99% of the people who prepared alongside you, don't know about that question, and those who will get it right just by chance. And don't worry, it will not affect your results for sure. What are the challenges that different student failed during this PG exam? One was the time management. As I said, that the questions were lengthy, so definitely they failed. That time was not appropriate. A lot of students failed that there was confusion between the two options, and it troubled them. Now, this is something new about the time-bound sessions, and I also relate to it. And after doing some research and thinking about it, I realized that actually this time-bound session is not a great idea, because when you have a question paper, like you have 200 questions, and now you have a negative marking as well. Suppose in set one, if I see a lot of questions that I don't know, I will not take a chance. I will not mark them because I am scared of negative markings. But as I always advocate, that in competitive exam you have to take a risk. But how do you know that how will be the next sets? Because when I have 200 questions in front of me at one glance, I know that I can take a risk, and I don't know. I know which where to take a risk and which questions to leave and which question to attempt. When you have time bound sessions, it's very difficult to make that choice, because for example, if I know 40 out of 50 questions here, and if I have 10, and same happens in all sets, then I won't be able to attempt 40 questions, and actually that will affect my rank, and that will virtually take me out of the race for the top ranks. So definitely this is something that we have to work on, and when we make plan for NICT session, this is one challenge we'll definitely address, and we'll see what best we can do about it. Also, to said that as I said in the previous slide, there were topics that were known to students. They have read it somewhere, but answering questions from those topics is quite difficult. Now, what this teaches us for November NICT, I will release a detailed video later, but just few take-home points. First, take time understanding the concepts and the topic, because the questions you find tricky because you know the topic and you know the commonly asked questions. But if the question is twisted in some different way, a lot of students are finding it difficult. That is why you should be thorough with your topics, should be thorough with your concepts. We have to learn how to manage your time. One, give multiple GTs. Spend, and whenever you solve questions at a time, and learn this habit. Like they say that whenever you have a long question, read the options first. So while reading the question, you'll automatically try to process the answer in your head. Plan better revision. As I always say, a lot of students, there are a lot of videos on YouTube that how to avoid confusion between two options. But trust me, the best way is the better revision. If you have revised your topic well, that confusion will be less. Also, be selective with your source. There are multiple sources available. I was just going through the comments on my video, and a lot of students were frustrated that I have, been preparing for so long. So many. You have to be selective with your source. I was just going through the comments, and realized and I saw that a lot of students were frustrated that I have spent so many months on preparing for this exam. I have given everything. I have sacrificed a lot of things, and still, I did so many mistakes, and a lot of things happened. So I think one of the reason is because you refer to multiple sources, multiple books, and you try to tick mark everything that is there. You try to read and revise every source. See, when you read it, you feel it nice, but when you really appear for the exam, that is the point when it feels difficult. So don't pile up the material. Be selective. This is the time that you finalize your source, you finalize your material. And lastly, practice more clinical questions. As you said, as we are seeing the NEETPG pattern being shifted more toward INICET like USMLE type, we have to be, very strong and very fluent in clinical questions. And for that, you have to analyze your GTs. Whenever you attempt questions in your grant test, you have to go through the explanations as well. A lot of students, they skip explanation, just read the answer. If the answer is right, and they go forward. So you know the topic, you know the commonly asked questions, but the questions are twisted, you will do the mistakes. That is the reason why you analyze it as well. Guys, that's all from my side for today. But definitely I'll be bringing more videos about planning for an ICT. For now, I want you to rest, and once you feel like okay, you are ready for to take on an ICT, because definitely you need a you know if you want to prepare for that, you should start for that as soon as possible as well. So guys, I hope this video will help you. I wish you all the best and take care.